Today, the treatment is very simplified, is more tolerable, more accessible, but still extremely expensive. By decentralizing, you manage to move the diagnosis and the treatment and management from the specialized care to a general practices and to a nurse-led model of care. It benefits the patients in many ways. They can have access closer to their homes, closer to the area that they live in. Imagine these are treatments that you need to monitor in, you need to have follow-up consultations, you need to travel quite a lot of times for follow-ups. Patients need to pay the transport, they need to use a lot of time to go to the hospitals. By being closer to them, you make easier access. When you need to decentralize, you have to simplify. Still, more work needs to be done, more accessible diagnostic tool and faster, so the point of care tools need to be developed. And in terms of treatment, when we started hepatitis C, it was super expensive and very toxic, very low tolerance. Only 3 out of 10 patients managed to complete the treatment because of adverse events and cost. And today, the treatment is very simplified, is more tolerable, more accessible, but still extremely expensive. So cost for drugs is one of the key issues that globally has to be addressed to be able to really reduce morbid mortality related to hepatitis C. When you work on hepatitis C, prevention is critical. Communities are accountable. In our case, we didn't manage to work with patients to empower them to be the voice of the no reuse syringes. And communities are responsible from the health of their communities, not only the beneficiaries. And they are the ones that can carry on the prevention messages. They are the ones that carry on the follow-up of patients. There is a social network, a community that is allowing patients to feel embraced, supported, and as well finalize the treatment. Communities are at the centers, is where we need to read what they need.